Okay, the cochlear nerve or the cochlear component of the vestibulocochlear nerve. Okay, where does the cochlear nerve originate from? Okay, it originates from the cochlea. Okay, and that is no rocket science, by the way. It's very easy to understand. So here's the cochlear nerve, and it ends up on the cochlear nuclear complex, which has a superior, medial, inferior, lateral, something like that. Okay, some lateral nucleus, superior nucleus, medial nucleus, inferior nucleus, like that. Okay, sorry here's the cochlear nuclear complex over here, and the same side on the other side as well. Okay, here's the cochlea and here's the cochlear nerve, and then the cochlear nuclear complex. This is the cochlear nuclear complex, which is drawn in the diamond shape. Okay. Okay, from here what happens? From here the fibers start mingling. Okay, so they go like this, over here and over here, like this, and towards the other side as well, like that. Okay, what is this? Now this thing is called a trapezoid body. Okay, and remember the fibers are actually mingling. So at this point, what is this, by the way? This is the superior olivary nucleus or sun. Okay, so at this point the superior olivary nucleus is receiving input from both cochlear nuclei, and this is actually important for a pathology we will talk about later. Okay, so over here it gets mingled like this, then it continues upwards like this. From here it continues upwards, over here same thing, continues upwards through something called a lateral lemniscus. This is actually a lateral lemniscus, and a lemniscus is nothing but a bundle of nerve fibers inside the CNS. Okay, this is a lateral lemniscus. Okay, lateral lemniscus. Okay, and thus it ends up on where? What is this? This is the inferior colliculus in the midbrain, right? Okay, inferior colliculus, and from here it goes and synapses with the medial geniculate body of the thalamus. Okay, not the lateral geniculate body. The lateral geniculate body is for optic nerves and optic radiation and everything else, that thing. The medial geniculate body is for hearing. Okay, and from the thalamus it goes and goes towards the auditory cortex in the temporal lobe of the brain. Okay, auditory cortex. Okay, this is the basic diagram for what happens when you hear. So let's just say we lesion the nerve from more places than one. Okay, let's just say we lesion this nerve, and from where does it get lesioned? What will happen if we lesion it from particular places? Let's see. This is, by the way, I'm viewing this from behind again. So this is the right cochlear nuclear complex and this is the left. Okay, so let's just say I'm lesioning this nerve from here. What's gonna happen? It's gonna result in loss of hearing from right side only, a unilateral loss of hearing, because the left nerve is actually intact and the left nuclear complex is actually intact. Nothing is going to happen on the left. The only thing which is going to be loss is loss of hearing on the right side only. And this is what sort of loss, by the way? This is sensory neural loss. Sensory neural hearing loss on the right side. Okay, let's say I am infarcting this area right over here. I have a stroke, a pontine stroke, and I infarct the superior olivary nucleus on the right side. What's gonna happen now? Okay, now remember, it is receiving inputs from both sides like this. So it is gonna cause minor, not major, minor, slight hearing loss. Bilaterally. Why minor? Because this is actually intact. So you can hear stuff from here and from here, because this nucleus is intact, so you can actually hear something, but it's gonna be minor and bilaterally because both sides are getting affected from here. Okay, same for here and here and here. Okay, bilateral minor hearing loss. Okay, so here's the cochlear nerve and the cochlear nucleus and the pathology associated with it. So if I've cleared your concept regarding it, I'm more than happy. If you have any questions, feel free to post and ask me. Okay, and this concludes our lecture on the vestibulocochlear nerve.